G-Roll Electronic Productions, baby.
Welcome to DEMOCREPUBLIX, where we cover the real news that matter to we the people. CDC sows doubts about COVID vaccines by nagging Americans who got the shot to mask up again. This is from the Federalist. The Centers for Disease Control and Prevention is sowing doubt about effectiveness of COVID-19 vaccines by demanding that vaccinated Americans mask up again. Using the Delta variant to justify its nagging, the CDC is shifting its masking recommendation back to encompass those who have received the shot and re-emphasize that children over 2 years old who attend K through 12 schools should continue to don face coverings. Health officials at the agency claim that, quote, new evidence found that the levels of virus found in breakthrough cases among the vaccinated people are similar to those found in unvaccinated individuals who contract coronaviruses, raising concerns that vaccinated individuals may be able to spread the virus. So, I say time and time again, what is the point of getting a jab if you're still going to get the virus? If it's still transmissible, what's the point of even getting a jab for? I mean, people are still dying from, even though they have the jab, they're still dying from COVID. 49 people. We did a report on the 49 people that died in New Jersey from and they died from COVID, and even though they had shots. But the article goes on to say the flip-flop comes just 2 months after the health bureaucrats lifted recommended mask guidance from vaccinated Americans. Quote, you can resume activities without wearing a mask or stay 6 feet apart, except where required by federal, state, local, tribal, or territory laws, rules, and regulations, including local businesses and workplace guidance, the CDC website stated. Now, as the corporate media mock and exploit the deaths of unvaccinated COVID patients, and might I add, they ignore the ones that actually took the shot and died from COVID also, even though they took the shot. They don't talk about that. But COVID patients to draw attention to the Delta variant. The CDC is walking back its original guidance even after promising just last week that there were no plans to alter mask guidance unless there were a significant change in the science. And if you look at the studies, the people that's actually still dying from COVID are older people, obese people, and they have other issues. They have comorbidities, and those are the ones that's dying, just like they do with the flu. People with the flu, if you're older or you had comorbidities, you can die from the flu too. So why I'm telling you, they're getting ready to shut stuff down all over again. I've been saying from the beginning that was the plan. That was the plan. I think by September, stuff is going to be shut back down again. Like the CNN report of the CDC's change claims the decision was made after a meeting to review new transmission evidence on Sunday night. But the White House began discussions about possibly urging more masking as early as Wednesday. So who's coming up with this policy? Is it the White House or the CDC? White House Press Secretary Jen Psaki and her staff repeatedly claimed that, quote, we follow the guidance and advice of the health and medical experts. Yeah, right. And that public health guidance is made by the CDC, and they continue to recommend the fully vaccinated individuals do not wear a mask. But even President Joe Biden hinted that his administration was itching for a change during the most recent CNN town hall event. Quote, the CDC is going to say that what we should do is everyone under the age of 12 should probably be wearing a mask, Biden said. That's probably what's going to happen. Some counties, such as Los Angeles, also jumped the gun 2 weeks ago and overlooked current CDC mask recommendations to demand that their residents, even those who are vaccinated against COVID-19, wear a mask indoors. Do you really think these people care about your health? These people do not care about your health. It has nothing to do with health or saving lives. It's all about control. And right here, this is from the Gateway Pundit. I have to give it to Peter Ducey. Peter Ducey from Fox News, he actually asked a real question, an important question. If vaccines work, then why do vaccinated people have to wear masks? Great question, common sense question, and let's see how Jen Psaki answered it. Well, Fox News reporter Peter Ducey on Tuesday grilled Press Secretary Jen Psaki over the weekend over the new mask regulations for vaccinated people. Officials told Reuters the CDC will recommend fully vaccinated Americans wear masks indoors. Quote, and this is what Peter Ducey says: if vaccines work, which signs say they do, then why do people who have the vaccine now need to wear the mask? Which is a great question. Let's take a look at what Jen Psaki retort is.
Guidance looks like.
The vaccines work, which this sign says that they do, then why do people who have had the vaccine need to now wear masks, the same as people who have not had it?
Because the public health leaders in our administration have made the determination based on data that that is a way to make sure they're protected, their loved ones are protected, and that's an extra step given the transmissibility of the virus that people that they're advising people. Guidance looks like.
The vaccines work, which this.
Yeah, this is just nuts. I mean, it's a common sense question. If the vaccines work like they say it do, why do they want everyone to mask back up? I got some stuff on here, some comments. Hoosier for life. Facts about COVID. What is that, Hoosier? Copper Skies said this channel needs more viewers sharing now. Thanks, Copper Skies. Yeah, man. I just try to put the information out there. Hoosier for life said I put a link in, bruh. Let's see. Oh, okay, I got you. I'll check this link out. Let's see. Oh, it's white screen. It's so bright. Hold on. Let me put it in a different browser. Whew. All right. Let's see. Will let me copy and paste it in here. Bear with me, y'all. Copper Sky says she couldn't answer. Yeah, that's true. She couldn't answer because it makes absolutely no sense. If the vaccine work like they say it does, then we shouldn't have to mask back up. Okay, this was sent from Hoosier for Life. Hoosier for Life. Sorry about that, Hoosier. This is facts about COVID. This come from Swiss Policy Research. Fully referenced facts about COVID provided by experts in the field to help readers. Lethality. Okay. So this is just from the Swiss government. I don't want to go through this online right now because this looks pretty intense. So I'll have to check it out at another time, and maybe I'll do a show about this. Hoosier for Life say about my name. What do you mean? Oh, I was right the first time, Hoser? Okay. Alright. But yeah, that's pretty much it about that. That's the whole point about that. If the vaccines really work, I love that Ducey asked that question. If it really worked, then why we have to mask back up? It's a mess. Hoosier said you can read off a few of those bullet points. Okay, I'll do that. Let's check out some of the bullet points. Overview. Lethality. According to the latest immunological studies, the overall infection rate, EFR, of COVID-19 in the general population is about 0.1% to 0.5% in most countries, which is most closely comparable to the medium influenza pandemic of 1936, 1957, and 1968. So it's similar to the regular flu. Well, they called it a pandemic back then too, but yeah, the cost your chances of dying from this, if you're healthy. Now, mind you, if you're healthy, you have no comorbidities, you're not severely overweight, you'll get it. Maybe have some breathing issues like I did. I had some breathing issues on one night, and that was pretty much about it. But other than that, it felt like a regular cold to me. Well, it really felt like a sinus infection to me. Let's see. Number 2 says treatment for people at high risk or high exposure, early prophylactic treatment is essential to prevent progression of disease, according to numerous international studies. Earlier outpatient treatment of COVID may reduce hospitalization and deaths by about 75%. Age profile, the median age of COVID deaths is over 80 years in most Western countries, 78 in the U.S., and about 5% of the deceased had no serious preconditions. The age and risk profile of COVID mortality, therefore, is comparable to normal mortality, but increase its proportionality. Nursing homes, we know that the nursing homes, in many of the Western countries, about 50% of all COVID deaths have occurred in nursing homes. That's because that's where the older population lives. So, of course, it would be bad there. Let's see, antibodies. That's something I want to check out. By the end of 2020, antibodies, seroprevalence, however you pronounce that, was between 10% and 30% of the population in most Western countries. All seroprevalence levels above 30%. A significant decrease in the infection rate was observed in many regions. Symptoms, let's see, long COVID. About 10% of symptomatic people experience post-acute or long COVID, i.e. COVID-related symptoms. This is why Biden is talking about making long-term COVID like a disability type thing. I think they're able to collect disability now. Masks. Look, this is an important one right here. Now, YouTube, do not shut me down for this. I am reading this straight from the Swiss Policy Research Report. This is from the Swiss is a Swiss organization. So YouTube, please do not censor me for this. I'm reading it verbatim. Mask. There is still little. Oops, sorry about that. There is still little to no evidence, and there's a study right here I'm gonna have to look at myself. But there is still little to no scientific evidence for the effectiveness of cloth face masks in the general population, and the introduction of mandatory masks couldn't contain or slow the epidemic in most countries. If used improperly, masks may increase the risk of infection. So it could actually increase. It's current to this July. Okay. I'm definitely going to save this report. I'm glad you sent me this. I appreciate you, Hosier. This is great. I'm big on research. I'm big on studies. I actually have a background in advanced statistics, so I can actually look at a lot of these studies myself and interpret it myself. So I really appreciate this. Copper Sky said the cloth face masks have one purpose: defeating facial recognition from authoritarian governments. Hey, but that doesn't work anymore. There's technology out now that's where they can still get your facial recognition even with a mask on. You should Google it and check it out. So that doesn't even work anymore. Let's see. Contact tracing, PCR tests. And I heard a lot of negative things about the PCR test. The highly sensitive PCR test kits may in some cases produce false positives or false negative results, or react to non-infectious virus fragments from a previous infection. In this regard, the so-called cycle threshold or CT value is an important parameter. And I watched some virologists talk about the PCR test, and it was like the PCR test, they have the threshold too high, and that's what the problem is. I mean, is it too high or too low? But anyway, it's too sensitive. They made the test too sensitive, where it actually picks it up when there's really none there. Hoosier said, I'm in Canada where the government has stronger restrictions than other places. Some of the harshest. Yeah, I've watched listened to a lot of interviews with people from Canada, and I know it's brutal out there. It's brutal. Lockdowns. This is an important one too. In contrast to earlier border controls, lockdowns have had no. Look at that. And here they linked to a study right here. So I'm gonna check out that study myself too. But lockdowns have no significant effect on the pandemic. According to the UN, lockdowns may put the livelihood of 1.6 billion people at acute risk and may push an additional 150 million children into poverty. And I may have done a report on that. I remember the UN talking about it. I can't remember. I might have either written or done a podcast on that, what the UN said about that. But I still think they're gonna bring them lockdowns back. Media. The reporting of many media has been unprofessional, has increased fear and panic in the population that has led to 100-fold overestimation of the lethality of the coronavirus. Yes, I remember when it first came out, especially in China, because China, remember them quote-unquote leaked videos that came from China where people was on the street just dropping dead supposedly. All that was false. All that was propaganda. So it makes you wonder, or it proves even more my assertion that China did this stuff on purpose. Because why would they purposely leak fake videos of people passing out and dying of COVID right there on the street, just dropping dead? And we know that stuff is fake. Virus origin. The origin of the new coronavirus remains unknown, but the best evidence currently points to a COVID-like pneumonia incident in the Chinese mine in 2012, whose virus samples was collected, stored, and researched by the Virology Institute in Wuhan. What a coincidence. I did not know that. This is news to me. And they got a link here. I'm definitely gonna go dig into that. In 2012, so the it was the pneumonia that was COVID-like, and they collected it and stored it in Wuhan, the Wuhan Virology Institute. Wow, that is crazy. Even the inventor of the PCR test has admitted it isn't entirely reliable. Yes, that's what I was talking about. That's the interview that I was watching. The person who created it was talking about it. He was like, yeah, I did not make it for this purpose. He said he did not create the PCR test for this purpose. I can't remember the original purpose of the PCR test. Oh, it had something to do with DNA, I think. DNA or DNA sequencing, or I think it had something to do with the PCR test. Had something to do with DNA. But yeah, that's all I got for today, y'all. I might come on a little later and maybe drop a couple more videos, because there's a bunch of news out there that I really want to get into. Really trying to make time to get to them. But let me know what you think. Share this out, please. Like, share, and subscribe, and share this out. Leave your comments down below. Let me know what you think. And check out DEMOCREPUBLIX.com for the latest in news. Until next time.